Good afternoon, everybody. Thank you for joining us. We are doing our specialty webinar series today, Health Information Exchange for Emergency and Urgent Care, why it works and how you can make the most of it. So we're going to be covering some basics about HealtheConnections and the services that we offer and talking specifically about how they can benefit those of you in emergency and urgent care and a little bit of something for everybody. So I know we have a variety of folks from different roles and organizations that are on the call today. So whether you're a current user or you're brand new and you've never used our services before, we're also going to share some tips and tricks for getting the best experience out of your usage with HealtheConnections. If there are any questions throughout the training, you can feel free to type in the chat feature. My colleague is on the call and will be assisting with monitoring that. And there'll also be time at the end if anybody would like to unmute, ask any questions, or share any experiences. We encourage you to do so. There will also be a short survey after the meeting or whenever you leave the meeting. You will see that pop up in a browser and you may have to click on a link. It's a very short, quick survey, so we appreciate any feedback that you have for us. So to introduce myself, my name is Alex Augustinos. I'm a customer engagement manager here at HealtheConnections. So I work with all kinds of different organizations on training and using our services and implementing them. Prior to working at HealtheConnections, I worked in a private practice where I was a daily user of our patient lookup portal myself. So if you're not already familiar with HealtheConnections and who we are and what we do, we are your area health information exchange, or HIE. You'll also hear us referred to as a RIO, or a regional health information organization. So HealtheConnections is one of 6 RIOs in New York State. We are one of the geographically largest. We have over 1,700 organizations that are participating and using our services. So all the little green dots that you see on the map there are our participants. And of those participating organizations, we have over 600, close to 700 of them that are also contributing their data and making it available to all of those participants. So we are a central repository for clinical information and patient records in our 26 county service area that we cover. So that dark gray region that you see on the map is where HealtheConnections covers. So from the Canadian border down through the central region, southern tier, and Hudson Valley. Within that footprint, we have over 11 million patients that are able to receive better care. We're receiving over 4 million clinical summary documents per month and over 420,000 unique patients that are accessed per month. So as you can see from those numbers, it's a very robust network, and we have lots of folks that are using the services and enjoying them. Overview of our main services. Patient Lookup is our core service, and that is our real-time web-based browser that gives you access to patient records. So that includes labs, imaging, medications, allergies, family history, social history, hospital transcription, all different kinds of clinical data that's available, community-wide record right at your fingertips. Included in Patient Lookup is our image exchange, which allows you to view not only radiology reports, but the actual diagnostic quality images that go along with those. So burden does not have to be placed on a patient to bring a disc with them, and any provider or user can have quick, easy access right through their web browser to those images. Does not require any kind of special software to be downloaded on your computer. We also offer a transfer to PACS service. So for those organizations that have their own PACS system for imaging, you can take any of the images that we have available and bring them right into your own local system. Our query-based exchange will give you access to statewide data. So as I mentioned, HealtheConnections is one of 6 RIOs in New York State, but we do have a connection with those other 5 RIOs. So if you have patients that have received care outside of the HealtheConnections footprint in Buffalo, Albany, Rochester, any of those outlying areas, you can run a query-based exchange and return a summary of any of the statewide data that is available. So again, saving you time and effort of having to track down that information. Our My Results service is another tab within our system. Any credentialed provider that is using our portal will automatically be configured to see their own results there, and other staff members can be designated as a delegate to view results for one or more providers. So within that tab, it will query by the provider's NPI number and return any labs, radiology, or transcribed reports. So one quick consolidated place to view all of that information. Our My Alert service allows you to be notified anytime patients are admitted, discharged, or transferred from the hospital or emergency department. So for our emergency and urgent care folks, what's going on in your organization is going to be quickly and easily accessible to others like primary care physicians and specialty care physicians who are involved in that continuum of care and are going to be following up with your patients once you are done with them. Our results delivery service is available with EMRs that have the capability. We can deliver labs, radiology, and transcribed reports directly into an EMR. So instead of having to scan records in or route them from an eFax or some other system, we can put those directly into your EMR. Our direct mail service is a HIPAA-compliant, secure email system that allows you to safely and securely exchange PHI with other providers or healthcare facilities that also have direct mail. So whether they have direct mail through us here at HealtheConnections or through their EMR or some other vendor, as long as that's a direct mail address, you know that you can safely and securely exchange patient information. And finally, our My Data service is available. Any organization that is sharing data with us, we can take whatever information is being shared and combine it with all of the community-wide data that we have available on your patients and organize that into easy-to-use dashboards. So for example, there is an ED and hospital utilization report. So again, for our urgent care and ED folks, that data that your organization is submitting is then able to be actionable and usable to everybody else that's involved in the patient's continuum of care. So talking about benefits specific to our emergency and urgent care organizations, you get immediate information on your patients. So obviously in emergency and urgent care, time is of the essence. So as soon as you have a patient's consent on file, and we'll talk about consent in a little more detail in just a moment, you get immediate access to their entire community-wide record. So as we mentioned, we have close to 700 organizations that are contributing their data, and there's a wide variety of organizations that are contributing data. So that includes other hospitals, primary care offices, specialty care offices, community-based organizations, mental health organizations. So you can very quickly and easily get a complete picture of your patient's history and health and where they've been going, and that's immediate. So it doesn't have any kind of wait time or any barriers to getting access to that information. You can also quickly and easily see if a patient was sent to the ED by their primary care physician. If that primary care physician's a data source with us, you can take a look at those notes. You can see what exactly was going on, why they were sent to you. You can check out and see, is the patient a frequent flyer? Have they been to another hospital or emergency care facility recently for the same issue that they're presenting to you for? Get some history and background of what's been going on with them so that you can deliver the best care. As we mentioned, you can view patients' medical images. So this is a great feature that allows providers to make more informed care decisions. So that radiology report will have a lot of great information, but sometimes seeing that actual image is going to give a richer, more robust picture of what's going on with that patient. Real world example, patient that broke their arm over a year ago. Now they've rebroken the same bone and they come presenting to the ED. Provider can take a look at that image from a year ago, take a look at the one that they're taking right now, and compare and look for changes so they can assess how bad that damage really is. Does this patient need surgery? Can they just be bandaged up? Really gives them a more complete picture of what's been going on. Sending and receiving clinical notes electronically with other organizations and providers. So like we mentioned, you have that complete community-wide view of where your patients have been going and what's been going on with them so that you can get all of the information that you need to care for them. And then when your emergency and urgent care notes are also part of HealtheConnections, then all of those other organizations and providers that are part of the patient's care team, their primary care physicians, their different specialists, if they have a care management organization that's following them, all of that information is going to be quickly and easily accessible to those other organizations as well. So patients get the greatest benefit when everybody on their care team has quick, easy access to that information. Eliminating duplicate testing. So just like we mentioned, not only with those images being available, but with all the other data we have available, labs, immunizations. Again, you can quickly see what has a patient already had done. A lot of times patients may present to the emergency room. They're telling you that they just had labs done with their primary care physician 2 weeks ago. But again, time is of the essence. Your staff doesn't necessarily have time to call and ask for those results to be faxed. If it's in the middle of the night, then that provider may not even be available to answer the phone and send that information. But when it's right in HealtheConnections portal, it's self-serve. You can get that information. You can save time and effort and resources when you have phlebotomists or radiology techs that are already bogged down and busy. When you have quick, easy access to those results, you don't have to repeat any of that testing that's already been done. So it makes for a better experience for the patient and lowers their costs, so they don't have to pay for additional testing if they have a high deductible plan. And again, saves your staff time and effort as well. Talking about consent. So patient consent is required in order to access any information in HealtheConnections. So hopefully you already have a consent process built into your workflows. So whether it's your patient registration or front end folks that are collecting that consent, once you have it in place, then it's good to go and you have it for any time that you might see that patient. So if they've already been to your facility before and that consent has been collected and already filed, then you're all set to go. Does not have to be updated annually like some of the other forms that you may have to deal with. Patient can change their consent choice anytime they would like to. So if you do have a patient that's presenting to you that has given a no consent, if you re-explain to them that, hey, we won't have to repeat this lab work if we can access it through HealtheConnections, would you like to change that consent choice to a yes? They can do that. They will just fill out an updated consent form and they can switch that at any time. Once one person has logged that consent for your organization, that also applies to anybody in your organization that is accessing the information. So consent is given per organization. So a patient might see primary care physician, several different specialists. They can give a yes consent to their primary care. They might deny consent to one of their specialists, completely at the patient's discretion. But if they're presenting to the emergency room, if they have already been to your facility before, or they've received care at another organization that is part of your organization and they've already given that consent, then it applies to your entire organization. Can't refuse care to patients who don't provide consent. So even if they say no, you'll still go about treating them the same way that you normally would. We also offer emergency access, or break the glass as it's referred to. For privacy and security purposes, there is only a limited use case for this, but it is very important for those of you that are in the emergency room and providing that emergency care to know that this is an option that's available. So we only have this available to certain organizations, and sometimes within those organizations only to certain users. So primarily our hospitals and emergency departments. But break the glass can come into place if there is no consent on file for a patient and it's an emergency situation. So for example, patient comes to the ER by ambulance and they're having a stroke. So they're incapacitated. They're not really in a state that they can even provide consent to you, and they've never been to your facility before. So there's nothing on file. In that emergency situation, provider can choose to break the glass, access that patient's record, and they might be able to get some really valuable information to help care for the patient during that emergency situation. So they may be able to see that that patient has a cardiac history, or that they have a severe allergy to a certain type of medication. Again, information that they wouldn't have otherwise had access to that could potentially help them save that patient's life. So while it is a limited use case, it's great to know that that's there and that's a resource for you that can help you during those emergency situations to deliver the fastest, most efficient, and well-informed care to a patient. So we're going to jump right into the HealtheConnections portal. So for those of you who haven't used it before, we can show you exactly what we're talking about. And for those of you that are already familiar with it, we do want to share some tips and tricks for getting the best experience out of that. So let me switch my screen here. Giving that a moment to load, and you should hopefully be able to see on your screen the HealtheConnections My Connections page. So when you log into your account, this is where you should land. This is your central dashboard for accessing all of your HealtheConnections services and information. So while we're here, a few quick things to point out. Center of your screen has news and notices. So if you do have an account with us, you want to get in the habit of keeping an eye on that. We'll always communicate if we have any new features or updates that are rolling out, or if there's anything going on that may affect your service. At the top, you've got a few tabs as well. Always have resources available to you under the resources tab. So if you needed additional support with some self-training materials, or you wanted to sign up for some of our other services, plenty of information there for you. And the Contact Us tab will get you in touch with our support team. So if you do ever have trouble logging onto our system, questions about how to use it or navigate it, or questions on particular patients, please don't hesitate to reach out to our support team. They're more than happy to answer any questions or walk you through any troubleshooting that you might have. Over on the left-hand side, we're going to click right into Patient Lookup. We are in a demo environment right now, so you're just seeing de-identified test patient data. But when you open to your search screen, pretty straightforward. You only need patient last name and date of birth in order to access information. And using just that last name and date of birth will give you your fastest results. And when we click into a patient record, when you have consent on file, you should open right here to your summary screen. So you'll see everything's divided out into different categories of information. So very quick and easy to find whatever it is that you might be looking for. Over on the left-hand side with your patient actions is where you have all of your controls. And there's this great button here, Configure Layout. So when you click there, you'll see all of the different categories of information available to you, and you can drag and drop those in your grid to display however you would like. So you can have as much or as little information displayed there as you want. If there's something that you don't need to see, you can take that right out. And then there's another section listed that you would like to see. You can update that, and it will make those changes. And you can change your view as often as you would like, but it will always remember your settings. So every chart that you go into, every time you log in, it will always remember that information. When you first search a patient, you'll also notice over to the right, data is limited to the last 180 days. Most recent is probably what you're looking for, and that should display for you immediately. But we do have full data on all of our patients. So if you do need to look back further, with your controls on the left here, you can either click Show the next 180 days or Show All Data. When you do that, it will query the system for everything that's available and populate each one of those sections. So what you see here on your summary screen is all of the aggregated data from those multiple different data sources that we mentioned earlier, giving you, again, that community-wide record, an entire view on your patients very quickly and easily. Allergies and medications are great ones to check. Patients often don't remember or know all the names of their medications, especially during an emergency situation. They may be in distress, they're not feeling their best, so it's not always the easiest to get the most complete information from them, which is why access to our portal is another great resource for you to make sure that you're getting the full picture on what's going on with your patient. Your laboratory section here, you'll notice they're flagged for you. So if you hover over, you'll get a little definition showing you that there's abnormal results contained there. And you'll notice in all of our sections, when you hover over, you'll get a little snapshot of information, giving you some vital information about where it came from, who the ordering provider was, and the date. Each one of your sections will display the most recent information right at the top, but you can click on your different headings if you'd like to rearrange that. Anything you want to take a closer look at, you can click right on the title, and that will pull up that full result for you. So again, results available in just a few seconds. And they're flagged for you with your up and down arrows to show above or below reference range. So very quickly and easily, you can visually see the most important information. You've got some options at the top as well. You can download the report. If this is something that you want to save and pull right into your own EMR, you can do that from there. Share and send to me will link to direct mail. So if you're set up for direct mail with us, this will automatically put this result into a secure message that you can then share with somebody else that also has direct mail. Your imaging section is where you'll find all of your radiology reports. And if we click in, you'll see line by line exactly identical to what you would get if you contacted a facility to fax this to you, but it saves you that time and effort. And with your images, so right at the top, you have some additional options. We can click on View This Image. It's going to open up a separate window and pull that actual diagnostic quality image for you. We saw how quickly that pops right up, does not require a disk. So again, a great feature, especially when time is of the essence and your providers need that information right at their fingertips. And plenty of tools to help you analyze those images as well. With your tabs across the top, you'll notice you also have a tab to view all images. That will also pull a list of all of the diagnostic quality imaging available on that patient. From that view, you can also pull up multiple studies side by side if you want to do a comparison. And if your organization is configured for our transfer to PACS feature, you can access the transfer from that tab as well. Under transcriptions, you can find potentially office notes or discharge summaries if your patient has been to another facility recently. So you can take a look for those details to, again, help you see what's been going on with the patient and how you can help them as they're at your facility right now. Depending on how a data source is sending us the information, if what you're looking for isn't under transcriptions, I always recommend take a look at documents. Again, here you can find office notes, care management notes, discharge summaries, things like that. Always recommend the View as HTML feature will give you the best view, and you'll see that complete document, again, right at your fingertips with all of the details that you need. Important to note, our system also updates in real time or as close to real time as we can get. So when a data source is sending us the information, as soon as that's been processed from our system, it should be updating right in the patient chart. So if you refresh, you will find that there will be any updates. So the information is timely and accurate for you. Few other items to point out. Under more patient information, you'll find some demographics, some additional tabs within here. Advanced directives, it's good to know that that's there when you're in the emergency setting. Consent will show you a history of the patient's consent with your organization. And insurance info, also nice to know that this is here as a backup. Patients often don't remember that information or don't have their cards with them, particularly in an emergency situation. So nice to know that that's there as a backup for you. You also have a tab right at the top for statewide data. And back on your summary with your controls on the left here, there's a button for statewide data. So just two different ways to get to that information. But as we mentioned earlier, that will query the other 5 RIOs in New York State if you have a patient that's received care outside of the HealtheConnections footprint, and will return for you a summary of any of the statewide data that's available. So again, saving you time and effort of having to track down and call or fax for that type of information. So you'll see that our portal is pretty straightforward, self-serve, and intuitive. Again, it gives you all of the information that you need right at your fingertips and the entire community-wide record that's available on your patients to help you care for them. So now's the time if you would like to chime in with any questions or if there's any information that you would like to share with us or experiences that you've had, please feel free to chime in and let us know. All right, if we don't have any questions, we will go ahead and end the session, but I want to thank everybody for taking the time to be with us this afternoon. Hopefully you learned something or had some useful information, and please feel free to share with anybody else in your organization that may benefit from this information. And anybody that doesn't already have a user account with us, you can access our new user form right on our website. And all of our information that we shared is also available on our website. And again, that survey should pop up for you when you leave the meeting. So if you had a few moments to fill that out, we appreciate any feedback that you might have. Thank you and have a great afternoon.